Hello, good afternoon. I'm Raffaele Vardavas. I'm a mathematical modeler with a background in physics, and I have extensive experience in infectious disease modeling and health policy analysis. I develop mathematical simulation models to understand complex social systems and to evaluate the impact of policy within them. So I'm going to give a talk today titled Leveraging Modeling to Inform Policy Practice. Let me just start sharing my screen at this point. So if you could bear with me. Um, okay. So the goal of this talk is to give a few examples of how the Alliance of Policy Research, a new initiative, can support clients with simulation models and analyses, helping translate complex systems into practical insights for policy and practice. So why do we need simulation models for policy? Well, the systems that we're trying to influence, healthcare, labor markets, education, different systems that financial systems, etc., are not just complicated with many moving parts, but they are fundamentally complex. The interactions between the many parts are important. So think about a complicated system like a clock, has many parts and has many of the different gears. But you can understand the system by looking at how these gears, locally, you can see how these gears are interacting, and by those the understanding of local parts at a time, you can kind of understand how the whole system works. A complex system is a little bit different in the sense that yes, it also has many parts, but these there's also the many interactions, and these interactions span the whole system. It's not just locally contained. So really, like looking at any given one part in isolation of the rest really doesn't give you the whole picture. And you really need to know all the mechanisms at play and understand them and simulate them to see what are the possibilities. Now, we could consider an example like traffic, for example. You have the situation of congestion, and you can consider the intervention of adding a lane. Well, adding a lane makes reduces the time people spend on the highway, make people they can go faster. They're not no longer stuck on traffic jams. Well, that might produce and induce a demand where people will increasingly start using the highway, reducing their reliance on public transportation. So adding a lane, you think might reduce traffic, but actually due to this induced demand loop can actually have the opposite effect, where essentially after some time, congestions return to the same levels as before, or may even make things even worse. You can have these surprising effects, and so it's important to understand these effects through the what are the feedbacks at play in the system? Are they do we have the feedbacks which are amplifying, feedbacks which are dampening, and how do these all play out? So we have um, so here's how like simulation models can work. You have essentially the data is absolutely important to calibrate our model to what was observed. Now, data alone, if you just look at the data alone, if you analyze data alone, that's of course just one realization that occurred, and that's important. We want to make sure that our simulation models tracks that. But obviously, so many different things could have happened in the past under different conditions. And of course, many different things can happen in the future across the many different conditions. So the idea is to make sure that we capture all the mechanisms at play, and then we make sure that we we tune the parameters within certain ranges of their values such that they can track the trajectories which were observed in the past. And that allows us, then, we have our intervention model. From then, we have our intervention, I mean, we have our model from which we can then start from a given point, the intervention point, we can start playing out the different possibilities of policies and also implement different shocks to the system. So under different no changes, we would get obviously the baseline or the status quo prediction or projection, and then we would do we can expose the system to the different shocks and then different policies, and we would essentially compare what is the delta, the difference between the outcomes in those policies and intervention scenarios against the status quo. And by looking at these differences under these different policies, under all the different possibilities and uncertainties of the system and these external shocks, we can then start to consider and map out and tabulate essentially how the performance of these policies and see which ones perform consistently well across all of these different possibilities and across these uncertainties, allowing us to select which policies are indeed the ones which are most robust. So here's some examples of simulation models for policies that we have worked on in the past and some that we would like to do in the future. So in the context of cyber security and cyber, we created a cyber attack simulation model where we considered a game theoretical model where you have a sector, businesses in a sector, and they're interconnected through supplies and business partnerships, etc. And they're exposed to each other. They invest in their own cyber security, and obviously left alone, hubs, the bigger of the firms, the ones which are most interconnected, would possibly invest more. But left alone, what we see is that the system as a whole does not achieve the level of global protection which we would like. So maybe introducing, because this would because the hubs would protect more than necessary, and the peripheral smaller firms would feel less of the perceive less of the exposure, and they invest less. So and this also depends on the network structure. So the idea is, well, what kind of subsidies and mandates or other types of incentive-based policies can be implemented, which would drive the systems, provide exactly these incentives such that the firms, the peripheral firms, would invest a little more and provide overall better security across the sector. Um, Another model is an agent-based model that we considered for considering decarbonization pathways and long-term climate policies and sustainability. Here we again considered a sector where there's an ecosystem of firms, they're competing with each other, producing a final good. But the government also introduces, interacts with them by introducing a carbon tax. So this final good that they're producing requires labor requirements and carbon, and there's also carbon emissions. But some firms might see if there's a presence of a carbon tax by the government, some firms might invest in the technology and get on the side where they prefer even higher carbon taxes because they can gain market share. And so the idea is, what kind of policies would allow a transformation towards more and more firms trying to go into that group of firms who want to gain market share and lobby for even higher carbon tax, and slowly transforming the system from a majority of firms lobbying for a low carbon tax to one which possibly could lobby for a higher carbon tax through their investment in decarbonization technologies, and of course the presence of this carbon tax. A third example is healthcare financing with path-dependent debt. Here we're evaluating policies where households borrow for medical expenditure expenses requiring tracking of the interactions between spending, debt, income, employment, and health over a lifespan. So this microsimulation model can basically reveals that policies that appear beneficial initially can generate unsustainable debt burdens for specific demographic groups over time. Um, and these things would not, these conclusions would not be able to be revealed just by cross-sectional data analysis, essentially. Y- you really need like these longitudinal trajectories simulated over time based on all these, they're informed based on the data and the assumptions that feed into the simulation model. Um, Last example is modeling access care. There are various simulation models out there which consider um, healthcare in terms of the progression of health conditions, also hospital finances and providers, as well as individual level decisions in terms of coverage and health coverage, the decisions in terms of insurance. Now, one could these models can be quite complicated, but they could be simplified by they're complicated because they're quite accurate in the sense they're tracking these individual entities one by one. However, one can group these entities into population groups and allowing to simulate these systems more as a system level, a system dynamic model which is compartmental essentially. So it's much faster, perhaps a little less accurate, but allows us to more easily couple the different components. And one can consider how the effects, the cascading effects of how, for example, Medicaid cuts would affect multiple aspects in the system in terms of decisions in terms of health coverage, the increase in number of uninsured, how this would affect hospitals and hospital finances, especially those in rural areas, affecting essentially allowing potentially leading to many rural hospitals to close, even reducing essentially the a key employer in those rural areas, and also what are the health the long-term health aspects of this. Um, uh, each one of these components are interesting on their own, but a nice aspect of this goal is to is to connect these types of simulation models and look at the fuller picture and any interactions which might between these components. Um, Let me just give you a quick example of a project that we've worked on a couple of years ago. Now, the illustrations here are taken from a report of a couple of years ago. It's given the report is a RAND report, and the illustrations, though, are not the accurate ones. These are just illustrative AI representations of what we found. But essentially, the project looked at the worsening healthcare workforce shortages as well across the United States. Hospitals continue to struggle with the persistent systemic shortages of nurses and other healthcare workers. For example, in California, Oregon, and Hawaii, recently, many nurses went on strike, but, demanding better work conditions. And we know that there's essentially this situation that there's a growing demand for healthcare. This is of course also due to aging population, but there's also the supply of healthcare workers due to exactly work conditions and other aspects is not growing quite as much, and this leads to this increasing gap, and so between the supply and demand. but and the projections here show, I mean, illustrative show how things can play out with lowering yeah, the nurses, primary care, and behavioral health providers. I mean, specialists. So to inform such a model, we talk to the stakeholders, nurses, understand what are the barriers to work and all the work conditions. What's the role of wages in terms of compensating for those perceived barriers? Looking at surveys on the workforce. And so doing this environmental scan to get all this information and data, and then quantifying, looking at the mechanisms that are important to incorporate into the simulation model, estimating the range of the parameter values that go into these simulation models based on the data, and then essentially running the model to look at the what if scenarios. Now, one of the important aspects of the system dynamic model is that incorporates compensating wage differential theory, where workers don't just respond to wage increases, they of course respond to the workplace conditions. As mentioned, the burnout, the perceived burden, administrative burden, and the violence that occurs on the workplace, and all of this can contribute to what we call the work reluctance. And if these barriers increase, you need higher wages to maintain the same supply. So we have this supply curve shift as shown here. And this is an important input to the simulation model, knowing the form of this curve. And it's, as mentioned, it's fitted to this historical data or the data that we obtain also from these different surveys and talking with the nurses. And this is exactly it's placed into the simulation model and to help make those projections. So what we do is, of course, we vary these parameters within the uncertainty balance, and we look at historical data for that. And again, these are AI generated illustrative models, but you can have the data within over time. For example, this is employed nurses as an illustrative plot, and you have the initial condition. You set your model to that initial condition, and that from that initial condition, and using the different parameter values, you essentially simulate all of these ranges of outcomes, and you have the distribution of the possible outcomes. And then the idea is, of course, to select the subset of simulation models, meaning the ones with different combinations of input parameter values, which essentially are best at tracking the trajectories which were observed. And once we have indeed that baseline, you can exactly, we measure the different, we play out the different what if scenarios, the different policies. Policies can be impacting, each of these barriers in isolation of the other. So one by one, so looking at one barrier and reducing that, or perhaps increasing recruitment, which perhaps could have a big impact, but not immediate, whilst reducing, perceived barriers has more of an immediate impact. And then what's the impact of increasing wages? So you could look at each one of them irrespective of the other, and then combining them. Obviously, combining all of these policies together has the biggest effect, but still, even combining all of these policies, eventually, what we do see is that the additional nurses needed to meet demand will inevitably still increase. Now, such a workforce model can then be coupled with what can be extended to see what happens during acute crises. So we could couple this labor supply dynamics covering workforce size, wages, and burnout with an epidemiological model of disease transmissions and hospitalizations. like during the extreme crisis, like a pandemic or the pandemic we lived through a few years ago, workforce depletion isn't just a symptom; it actively worsens the outcome. The diagram here highlights the key feedback loops that where surges increase hospitalization and exposure risk, which triggers pandemic reluctance, essentially, acute withdrawal of the labor due to fatigue, mental anguish, or mental strain, and also access to childcare and the disruptions to that. So this accelerates attrition and worsens key workforce ratios. And the critical insight is that the feedback, as workforce availability drops, epidemic management becomes less effective, which fuels further disease surges. And this reinforcing loop captures the vicious cycle that could be missed by models which don't consider this coupling in this endogenous way. I mean, remember also during the pandemic, we had the situation where a lot of the nurses chose to become staff nurses, chose to become travel nurses to earn a lot more under those conditions. And of course, these travel nurses were working alongside with staff nurses, but with a very different wage. Compensation and this difference and the perceived difference really also could amplify that uh, the rate at which the staff nurses chose to become um, travel nurses or um, right, contract nurses. So basically, with it, this is my final slide. Just to conclude, essentially, the idea here is that the core philosophy is that simulation models reveals emergent causal dynamics and allows us to explore the counterfactuals and policies of what if scenarios beyond just looking at the historical data and doing statistical analysis on that. And this allows us then to play out the different futures and evaluate robust policies across the many plausible futures. And it's not just to make a projection, but really to compare the different projections against the baseline and identify what works best. Now, a word about the role of AI. Now, of course, and also, first of all, before the role of AI, simulation models, as I mentioned, are a tool to assist expert judgment. We still need, of course, the experts and to inform how these simulation models work, but also then to interpret the output. In the same way, with the use of AI can really accelerate the development and the deployment of these simulation models. But again, we need experts to make sure that what is being implemented by these AI models is indeed correct and captures all of the feedback so that we intend to model and the important aspects. So they're extremely powerful tool, but we have to be careful in terms of just relying so much on these tools. They really are to assist the experts, both the modelers and the experts in the domain experts in the field of the system that's being modeled. The other aspect about AI, these tools can create surrogate models, essentially emulators, which are trained on the on a large range of possibilities and outcomes which are created by the simulation model, so that because simulation models can generally be quite slow, these emulators and the AI tools, once they're trained, it can be very fast. They can be extremely useful to get results pretty fast. On the other hand, we have to be very careful that when we are looking at the outputs from these generated AI models, that on what data they were trained on, because as mentioned, AI are great at pattern recognitions and exactly identifying different patterns, but on the trained data. Now, if we are straining the system and we're looking at the simulation model, and in extreme cases, the simulation model captures these mechanisms and can play out the different things. But if these emulators or these surrogate models are asked to make predictions beyond the data that they were trained on, they can struggle, and there's a big risk, of course, of misinterpretation of these results. So again, this is a situation where you need the expert to guide how these tools are used. But again, we live in this situation in this era where AI can really make this workflows really faster. I mean, the development of these simulation models and deployment and doing these analysis much faster and also cost effective. More cost effective. Anyway, I hope this has been of interest. Was a recorded presentation. You can reach me again. My name is Raf Vardavas. You can reach me by going to um, the website on allianceforpolicyresearch.org. You go to people and you can find me there. If you have questions and interests about this, let me know. And hopefully you'll just browse through that website and see the full range of our interests and expertise. Thank you.